My name is Emily Musing. I'm the Executive Director of Pharmacy at the University Health Network.
I'm Marissa Battistella, and I'm a pharmacist at the University Health Network.
My name is Sherry Pizerniak. I'm the cardiovascular and vascular surgery pharmacist at Sunnybrook Health Sciences Centre.
My name is Stephanie Carlin, and I'm a third-year student at the University of Toronto, and I'm studying pharmacy.
Bill Wilson, Director of Pharmacy at Mount Sinai Hospital in Toronto.
Tom Payton, I'm the Director of Pharmacy at Sunnybrook Health Sciences Centre.
My name is Georgina McHale.
My name is Uchenwa Genus.
My name is Gary Wong.
I'm a clinical pharmacist.
And I'm a pharmacist at Toronto General Hospital.
I work here at Markham Stouffville Hospital.
And I'm a clinical practice leader over at University Health Network across the street here.
I'm Sharon Xiao, and I work in the ICU and pediatrics.
I'm Cindy Wong. I'm a perinatal pharmacist at Mount Sinai Hospital.
One thing I want to happen at work today?
Today.
What's one thing that I would have
liked to have it today at work?
Well, that's a good question.
Besides have a good day.
That's
I'd like everyone that goes home from my floor to have a good understanding of what's going to happen with their medications when they go home and make sure that I've helped them with any questions.
I guess just to be able to make a difference in terms of the care of my patients. If I can do one thing good today to help out one of the babies or families or parents, then that would make it a good day for me.
Probably going to my floor and seeing if I can, checking my patients and seeing if there's any drug-related issues that I can help resolve or help sort out.
It would be nice today to know that I've helped someone do something or accomplish something that they wanted to do.
I mean, right today, I guess I'm right in the middle of issues related to the pan-influenza right now.
This quote swine flu, and we were organizing and getting all the information we needed to make sure that we're ready in case anything happened.
What I want to happen today is that WHO will not declare today that we are actually at a level 6.
That we had to break out the plan.
Which brings us actually into a formal pan-influenza.
So that's what we were working on. We're ready to go. So that was one thing today, yeah.
I mean, you're always, the good days are really the days where you've had an impact on a patient.
One of our patients had, I'm laughing, it's not really a laughing matter, but we supply compassionate use of medications, and we did get a supply of Viagra. So I made a patient's day today by having the box given to him. His eyes just lightened up, so it made my day.
For each patient, I guess, that I see, to improve make sure that there's one DRP that I address, so that's a drug-related problem.
So whether it was you identified a potential drug therapy problem and you were able to prevent complications from happening, or you just had a recommendation about something that might have been missed or overlooked by the rest of the healthcare team, and you were actually able to get that recommendation put into place.
One of the bigger things that I like to see accomplished is people working together. It's a great feeling to be able to be part of something bigger. And realize the small things that you do every day that do count and do contribute to something big. So maybe to be able to help somebody find something, or look up something, or accomplish something, or maybe a patient on a personal level. And I think interacting with patients is a very important part of our day. So I think maybe interacting with a patient and making a difference in their stay here would be something.
I think that's one beauty about hospital pharmacy, because it's very flexible. You're able to do whether it's teaching or research and those types of things.
I really enjoy the flexibility of the day. There's a variety of things that happen in a day.
So yeah, you do the same job every day, but you face different challenges and you learn different things. And I've been here for probably about 6 years, and I can say that every single day I learn at least one thing new.
What I enjoy most about the job is the interactions with patients as well as other healthcare providers.
And that's a great thing in any career, when you feel like you're continuing to learn and you're not, you haven't stopped learning.
There's
there's a lot of opportunities to interact with other pharmacists socially and also professionally.
And from the social point of view, I work with a fantastic team. I am the only pharmacist specifically in hemo, but I work with dietitians and social workers and 9 nephrologists and of course a ton of nurses. And we have an interesting day every day, and socially we make work fun.
At this point, I'm interested in hospital pharmacy.
I think it'll be a lot more rewarding for me working in a hospital because I can apply more knowledge.
Compared to community, it's the place where we can make more of a difference in the patient's quality of life.
I like that there is the opportunity to specialize and go into different areas like cardiology or respirology, emergency medicine.
So we're interacting with more healthcare professionals as compared to community.
Nurses, physicians, and other members of the pharmacy team.
I want to work in a hospital pharmacy because 80% of the staff is female.
Yeah, I guess with my experience, I guess it's come as no surprise to all of you that the role of the pharmacist is really evolving.
So having said that, you're sort of set to be in line with the movement that the profession is making?
Well, in the hospital setting, I should say that there's been a lot of growth in general.
We're moving into expanding our clinical services.
Probably delegated acts, looking at delegated prescribing acts is probably one of the big areas that you will see developing in the next couple of years, giving us more responsibility and more opportunities.
So in the past few years, we've been very strong in providing clinical pharmacists and clinical support to the floors.
I think they turn to us, physicians and nurse practitioners and the nurses, for advice, and so we already have that role, and I can see it expanding even more. And I think we've done a good job establishing our role as a pharmacist as part of the healthcare team.
It's pretty clear that we are now living what we used to call clinical pharmacy practice, that the bulk of the work that pharmacists do is really to the provision of direct patient care. I expect that we're going to see just more of that we're going to continually use our pharmacy technicians to delegate as much as we possibly can to them. So, I envision a day where our pharmacists will be fully employed on the floor every minute of the day that they're here.